Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Aspirin. Aspirin is the oldest NSAID. Aspirin is the oldest NSAID and it is derived from a bark of willow plant. It is synthesized by Hoffman at 1999. The mechanism of action of aspirin, it covalently acetylates the COX and thus it results in suicidal inhibition of the COX. Because it acetylates the COX and thus the COX enzyme will also die along with the aspirin and thus it causes, there is no production of prostaglandins. So this aspirin is an anti-platelet agent. It is an anti-algesic or analgesic. It is an analgesic agent, that is, it is pain reducing. It is a uricosuric agent causing uric acid excretion in the urine. It inhibits the inflammation, so it is anti-inflammatory agent. It is antipyretic agent because it decreases the fever. Aspirin is the most commonly used NSAID and it is the longest acting anti-platelet drugs. It is a longest acting drug. It is a anti-platelet drug because it blocks the platelet aggregation and it is used for more than 72 hours. It is an anti-platelet drug mainly at a lower doses. The dose of aspirin which is acting as anti-platelet drug is 40 to 325 milligrams will act as a anti-platelet drug. Pharmacokinetics of aspirin. Aspirin is well absorbed. It is a weak acid with a low pKa, that is pKa is around 3.5. It is mainly absorbed from the stomach and it has half-life is shorter and it undergoes mainly the glycine conjugation is seen and it is eliminated in the urine. The uses of aspirin is it causes rheumatoid, it is used in rheumatoid arthritis, acute rheumatic fever, Still's disease, or it is used in familial adenomatous polyposis and closure of patent ductus arteriosus, or it can be used in niacin induced flushing, or it can be used as an antiplatelet agent for secondary prophylaxis of migraine. Secondary prophylaxis of MI. It is used as an antiplatelet agent mainly for the secondary prophylaxis of myocardial infarction. Side effects of aspirin. Aspirin can cause most commonly dyspepsia is seen especially in peptic ulcers. It can cause perforation or ulceration. Because of ulceration there will be bleeding resulting in hemorrhage. This can cause obstruction. Because of the antiplatelet action, it has high bleeding tendencies. It causes bronchoconstriction and bronchospasm. It can result in edema. It can worsen or precipitate the congestive heart failure or nephritic syndrome. It increases the risk of hypertension. And one more thing, thus the aspirin is contraindicated in certain conditions, especially it is contraindicated in peptic ulcers because it increases the ulceration and hemorrhage and it can even cause perforation of the bowel. It is contraindicated in bleeding disorders because it itself inhibits the platelets, thus increasing the bleeding in these patients. It is inhibited in nasal polyps, asthma, and also in the children with viral fever, because especially in children with viral fever this aspirin can result in a syndrome called as Reis syndrome occurs when the children with viral fever ingest aspirin. In polyp and asthma, actually aspirin inhibits the COX pathway, so there is less prostaglandin, so it results in bronchoconstriction or bronchospasm. Asthma and nasal polyps by itself causes bronchospasm, so overall aspirin is contraindicated in bronchospasm.
thank you and thank you for watching.